MCO. And then, of course, we've already gone over this, the Douglas stress test. So again, you're moving the distal part of the tibia laterally, stretching the medial lateral ligament. And then that has all the details there. Again, you can do it in neutral position with full extension, and then you can try varying amounts of a little bit of knee flexion. Actually, why don't come on here? I'll just demonstrate those. Right back with the front there. So again, I'm usually going to do it like this to get, where you get some more force in there. If you're down on here, you're not necessarily going to get a lot of drive into it. Slide down so that your knees are at the edge. Another way you can do a lot of these knee tests is you can go in like this and hold it this way, and then you can do some of the other tests here. So again, so this is going to be which one? August, and then this is going to be your Varus. I want you to stay there because we might get a couple more. So obviously then there's the Varus position. And then of course, everybody's going to have different amount of laxity in their knees, so obviously you're just going to compare one side to the other. And then the drawer test, we demonstrated that one already. So what you can also do is you can put, if you put your thumbs just like this, where the bottom of my thumb is on the tibia, the top of my thumb is on the femur. So then you can actually feel what's going on in the actual joint. So I'm going to palpate here like this. And typically, sometimes in the descriptions it'll say to sit on the foot, but it's not like you're really sitting on it, you're just sort of going like this to stabilize it. And then putting the base of my thumb here, and then the top of it's on the femur. So I'm pulling like that. And then again, you can turn this in, and that should tighten it up a little bit. All right, and then we'll go into the Latchman. Let's see. So that's just a modification of the anterior drawer. And that's the one, I think it's not in the notes, but it's on that extra little handout sheet. Okay, so what you're doing is you're doing the same thing, and you're putting the knee into about 30 degrees of flexion. And then you're just pulling up like this. So it's just changing the degree. Sometimes it's a little bit better test than when you have the knee into this full, more degrees of flexion here. So you just pull it into here, like that. Okay, and then some of you will want to watch this, some of you won't. So you can see that doing things it's not supposed to do. And again, you can get into more details as far as other ligaments that are part of the structure of the knee. But primarily we're talking about the ACL. But you can talk about some of these other ones, posterior oblique ligament, popliteus ligament, things like that. But it's more so we're talking about the ACL. Okay, well, I'm waiting for this to go to the next page. What's the next one in the notes? Probably either Slocum's or Slocum's. Okay. So what we're doing now is we're trying to differentiate between, when we're talking about anterior posterior drawer, we're talking about single plane instability. Right? So now we're going to talk about adding in some rotation, and we're talking about multi-planes. So the easiest way to think of it, like I said, is that when I externally rotate, which part of the tibia has moved anterior, the medial or the lateral? Okay, so the part that's being brought to the front, and now we're going to pull forward like this. So now we're testing for anteromedial instability. So just think the medial part of the knee has come more towards the front. Now we're testing for anteromedial instability. And then if we go the other way, now we're talking about what? Anterolateral instability. Okay? And then Houston's is the posterior ones. So now, when I turn this direction, on the back side of the knee, which one has moved more posterior? Medial or lateral? Medial. So when I press back like this, I'm checking posteromedial instability. And I turn this way, I'm checking posterolateral instability. The slocum's where you pull forward. Whichever side has moved forward, you're testing that side. So external rotation is anteromedial. Interrotation is anterolateral. And then the converse, when we're pushing back, this side, the medial side, has moved posterior, so I'm checking posteromedial. And then when I go like this, I'm checking posterolateral. Okay, so just think of it as 4 different parts of the knee. Which one is getting a little bit extra stress? And this doesn't want to cooperate. Okay, so then there's the posterior. Let's see, I didn't play this one yet, right? So here's another one. You might want to see it, you might not. So you can see how the tibia is moving farther back than it should. Okay, so that covers all the ligament ones. So then here, like I say, you have slocums is where you're turning the knee in and out. Depending on which side is more anterior, that's the anterolateral or anteromedial. And then the Houston's posteromedial, posterolateral. It just depends on when you rotate it, which part has moved more posterior, then that's what you're stressing, either medial or the lateral side. So it's just more quantitative ways of identifying different parts of the knee or which multiplanar instabilities that you have.